So how was therapy?
I dumped my therapist.
You did what?
I dumped her. I had to. Honestly, your relationship with your therapist is kind of like a relationship with a man. If there's no spark, if there's no sizzle, if you're not challenged, I mean, what's the point?
Dish, dish, dish.
Hey y'all, it's Onika
And JR.
and you are dishing with Dainty Dish. How you doing, JR?
I'm doing okay. I'm holding a pop filter in my hand, but other than that, I'm doing okay.
Most of the listening audience doesn't know what that is.
Does not know what that is, but it's okay. Having a good time. I'm doing well. Doing my thing, dodgeball, work,
Okay,
life, spending time with my parents a lot.
that's good. How's that going?
Really cool. I've been watching a lot of sports with my dad,
That's cool.
and hanging out with my mom, so that's pretty
That's
cool.
cool.
But yeah, what's going on with you? You lost your therapist.
I didn't lose her. I dumped her.
You dumped
I
her.
dumped her. It was over the phone too. I couldn't actually bring myself to go in and talk to her. I was just like, I couldn't even look at her and do it because, she's no offense to her. She's an amazing young woman, but she's much younger than me. She's a student, doing her residency. So she doesn't necessarily have the experience that my former therapist who, got pregnant, had a baby, and is on an 18-month leave, has, the connection that we had was far different. I'd come out of therapy with, like, homework and stuff and, like, things to do and, advice. But I feel like she just kind of mirrors me, and I'm not, like, we're not connecting.
Oh, okay.
Like, we're just not connecting. I tried. I gave it a shot, and I just had to say, you know what? It's done.
Fair enough. So what's going on?
Nothing much. Applying for jobs in the peer support worker field. Hopefully getting some calls soon about that. But it's all kinds of crazy Wednesday.
Absolutely.
And we have a guest.
We do?
So let's get to the guest.
Hello.
It is Emily.
I know, and I sound all sultry because I
You
have
do.
laryngitis. So I thought it's like I said, it's not. I'm not trying to mask my voice so that nobody knows who I am. Happy to say who I am. I just decided to bring my jazz voice tonight.
To the show today.
Yeah.
Some smooth jazz.
Smooth jazz.
I like it.
Oh, y'all. Yeah.
I like it. It reminds me of like an SNL.
It doesn't it? It's the sweaty balls.
Sweaty balls. Thank you.
And so smooth away. Good times. Good times. Yeah, good times.
Sweaty balls.
We just need some Alec Baldwin up in here, and then
We'll be good.
Yeah.
Have you ever had to dump a therapist?
I have broken up with more than one therapist, actually, for very different reasons. I might beg to differ a little bit about the spark thing. I think sometimes it can be a slow burn, like with a relationship. It could be like you're not having sizzle, but you grow, like it grows into like a really a slow development of how you work together. Mm-hmm. But I've had, I think you mentioned this, I've had someone who was really young, and although I'm all for, training, kind of that residency thing or the training in terms of, real world, it's hard to be the lab rat a little or to be the one who they're training on when you've had a lot of therapy. Mm-hmm. And you sort of feel like you're helping them along, or they're giving you a lot of things that you feel like you've done before. And that can be tricky, and I think it's just about being really honest and saying it's not the right fit, and that someone else who's maybe newer to therapy or has a different needs would fit this, but it wasn't for me. And I've also had to, I might bring this up later, but I've had to leave a therapist where there was some not really appropriate stuff happening in terms of their behavior, so I made the decision that I wasn't going to report it, but that I was just going to leave and cut that off. Wow. Yeah, so that was really, really tough, because psychologically that was really tough to be left feeling like someone you really trusted kind of broke that trust, and you feel quite vulnerable. So, but in retrospect, I think I was also ready to leave at that point to kind of have some time without a therapist.
Yeah.
that didn't last long, but so I think it's probably happened to a lot of people who've had therapy for any long period of time.
Yeah, I've been doing it since I was 17, so
right, yeah, exactly.
I could spot one from a mile away, like,
yes,
we're not going to get along.
I guess it is kind of like relationships. The older you get, the faster you know when someone is just
you're
not
you're going to be wasting my
This
time.
is not going to happen right here.
No.
No, it's good. And it's important to be aware that you have that choice, and that's an important part, is finding the right fit. It's not like you have to accept, same with a family doctor, same with anything else. It's okay to say, no, this isn't working. Let's try something else. Mm-hmm. Yeah.
So I just want to start by saying thank you so much for being on the show. I've heard your story. JR has not. We call him JR on the show, but you can call him Julian. Call him whatever you want.
Can I call you Bob?
Call him Bob.
Sure.
Whatever. Yeah. Call him Bob. But yeah, he hasn't heard your story, so I want you to share today with us.
Yeah.
Just start from the very beginning, as Julie Andrews would say. It's a very good place to start.
That's right. We love Julie Andrews.
We do.
Well, it was a dark and stormy night. So
don't be afraid to laugh.
Right.
Don't be afraid to laugh.
Lord, goodness knows it's the only way to get through. So I would say, my story is it's probably pretty long, and I might confuse some dates along the way, but hopefully. Hopefully I can share really honestly. I would say it didn't really start my story, as it were, until I was about 19 or 20. I was always an anxious kid, but there's a lot of anxious kids, and I definitely exhibited signs of anxiety early on, but I had nothing in my past that was like, to like a trauma or something that led to anything that I can draw on specifically. But around 1920, I was at university, and I was the most stereotypical, like, high-achieving, like, in sciences, want to be a doctor or, like, a researcher, and I'm going to do this and this and this, and I'm on the tracks. And then I think I just overwhelmed myself. The anxiety built up. I started to get very obsessive about everything. I started to try to add so much to my life that I wasn't able to cope. I don't think I'd ever learned how to cope. I'd had great parents who, when I lived at home, were probably overly great parents, in the sense that things were fixed for me a lot. And so I don't think I knew how to cope. And so in second year, I ended up basically burning out. I came home for Thanksgiving, and because I was such a great student, I was taking all my notes and I was condensing them and doing all this stuff. And the very first night we got home, my mom said, let's watch a movie. We're all going to hang out Thanksgiving weekend. And I was like, no, I have to go and do work. Like, it's Friday night. I don't have any time. People are coming tomorrow. And I started to take my notes, and I would glue the pictures from the slides into like a notebook. This was back before everything was done on like our iPads and stuff. So anyways, I realized, looked at it, and I had been gluing everything upside down. And I thought, oh my God, what is going on? And my body froze, and I couldn't move. I didn't understand what was going on. It was so frightening. I guess it was like I was catatonic. Yeah. I was so exhausted and fraught, and all I could think was, how am I going to get everything done this weekend now? I can't even move. And my mom had to pick me up and put me into bed, and she didn't know what was going on, and I just slept. And then in the morning, she came and she said, what's going on? And I was like, I think I'm just so overwhelmed. I'm so exhausted. I'm trying to do everything. And I'd taken up sort of running, and I was trying to eat really perfectly, and everything was like trying to be just everything in order. And I'd sort of snapped. And she said, you need to take less courses. And I was like, I just still felt sick to my stomach when she said it. And then she was like, do you need to just stop? And then I was like, that was the only moment that I sort of was like, yeah, I think that's the only thing I can do. And so that sort of started the process of this whole opening up to this idea of mental health. I think before that I hadn't really thought about my mental health too much, although my mother is an art therapist, psychologist. My dad's a philosopher, so you'd think that. But yeah, so we decided I would leave school, leave U of T and move back to London, Ontario, where I was from, and that was tough. It was tough leaving school. U of T was actually quite good. They had bursaries for this sort of thing when someone had to leave, and it helped me pay my rent until they could get a subletter. And I went back and I just took the rest of the year off. And when I say I took the rest of the year off, people are like, what did you do? I'm like, no, I didn't do anything. Like, I found a therapist. My mom helped me find a psychiatrist, actually. I'm really lucky. I sort of checked my privilege that my mom was in the field and she knew someone who might have an opening. And I got to see someone, and I fairly quickly got on some medication. I had lost weight. I never had any body sort of dysmorphia. I didn't think I was too big, but I got so obsessive about everything. And I think I was under so much stress that I'd lost weight, and I was getting obsessed with working out and eating, and I got diagnosed as having sort of an eating disorder, but like I'm not otherwise specified just in terms of my obsessiveness. And so I started on Paxil at the time, and it seemed to suit me okay. I think it's hard to, and I think a lot of people can attest to this, who've gone on medication but also started therapy and started to work on things at the same time. It's really hard to pull everything apart and know whether it's the therapy or the pills or the... I will say, I don't ever think you should start really medication without talking to someone regularly, because I think it's actually a bit scary as you start to feel better sometimes, but you don't feel great. You just feel a bit better. You're kind of like, is this it? Is this good as it gets? And now I'm on this medication, and I still don't really want to do anything. So, it was tricky, and I was navigating that world, and I decided to enroll back in school for the next year, and I took a holiday with my parents, and I would go to the library, and I learned how to do cryptic crosswords. Like, I literally took that time off to just figure it out, and that is, again, check my privilege. Like, my family could support me to do that, and I can't imagine if I'd had to work or had to do those things, because it felt like a full-time job, just like figuring out what I was doing, going to my doctor's appointments and sort of doing even just like the homework and just psychologically getting out of, going in the day. And so after, during that summer, I went back to school for summer courses because I'd missed some stuff, and I was going to go back to Western instead. And during the summer, I was doing better. I'd say I wasn't doing great, but, I gained a bit of weight back. I had been psychologically doing better and reconnecting with some friends. And I would go to the gym sort of in the morning, nothing too intense, but fairly obsessively. Like, I had to go before class because, like, that's what you did. And one day I was at the gym, and I had a very painful experience in my hip, and I was like, what is this? I feel like I dislocated my hip. And I still went to class. I was taking organic chemistry. I went there and sitting in the classroom, and I was in excruciating pain, and I was like, I can't do this. I got up and I called my dad, and I said, who also works at the university, and was like, can you come get me? Like, I think I need to go see a doctor because I think I dislocated my hip or something. I don't know how. But so we went to see the doctor. We went to the emergency room, and they were like, what did you do? And I was like, nothing really. I was on an elliptical machine, like, just started hurting. And they were like, well, it's probably a bursa. It's probably just like a muscular thing that you've overcompensated or overused something. And so why don't you just take some Advil or anti-inflammatory? And they didn't even say, and call me in the morning. They were like, and get out of here now. So I did, and I left. And at the time, I had been seeing a chiropractor because I have some jaw issues and things like that. And at this point, it was like, I'll do anything. I'd see anyone. He had just like waved a magic wand and tell me it worked. I would have been like, sure, I'll try. So anyways, I had seen a chiropractor, and she was like, given your history, given the issues with having lost weight, given your body stature, like it's actually quite hard for me to gain weight. It's possible you have a stress fracture or something. And I was like, okay, that's pretty freaky. And so I ended up talking to my doctor, getting an x-ray. The x-ray didn't really show anything. Again, they were like, I don't know what this is, so go see a physiotherapist. And the physiotherapist I went to basically said, okay, we think it's a bursa. We think it's a muscular thing. You know what? You need to do exercises that don't hurt so that you're working on compensatory muscles. At this point, I'd put myself on crutches because I was hurting all the time. But it didn't hurt to do weird things. Like, it didn't hurt to go on a stationary bike. Didn't hurt to bike. So I was like, you know what, maybe I should use a bike more to get around. So my dad, I don't know why it kept being my dad. I'm very close with my mom too, but my dad took me to the bike store and we were going to look at a bike, and I was going to test it out the back of the store. And as I went to ride the bike, a car came, and so I had to stop. And I stopped and I put my leg down. And it was kind of like when an older person breaks their hip and they don't fall and break their hip. They literally like put their foot down, their hip breaks and they fall. So I put my foot down. Obviously, it had been very fragile at that point. It must have just happened. And I crumpled to the floor and was, as you can imagine, I was screaming a lot and nobody knew why, because I didn't really have a big crash or fall or anything. My dad was sort of freaking out. He pulled the car up and they didn't know what to do. So they picked me up. They put me in the car. I got buckled in. All the meanwhile, just going like everything I did was so painful. And we drove to Emerge. And in Emerge, I said, what happened? And they were kind of like, oh, my dad was like, I don't know. She sort of put her, like the bike fell. But I said, I dislocated it. I can feel it. I know I did. And they said, no, there's no way. You're too young. It couldn't have happened. Just wait. Here, we'll get someone to see you. And so they put me in the waiting room in a wheelchair. And I sat there for like over 3 hours or 4 hours until I was screaming so loud that some other people were like, I think she needs to go in. Somebody can. And so they got me into a hallway and they put me on a gurney, and someone I just have vague recollection of either wishing I would pass out, like just being like, please body pass out because I can't take it anymore. And someone came up and said, can we give you some oral painkillers? And I was like, no, you cannot. I need a big injection and I need it right now. So they gave me some Demerol. Interesting thing about Demerol is it sort of, the only way I can describe it is it was like I still was in pain, but the pain was over there. Like it wasn't inside me anymore. It was like pain was there, but if you imagine pain, it's like a big blob. It's like I had picked it up out of my body and plopped it on the shelf beside me. I don't know how else to describe it. So that was good. And then they took me to the x-ray, and it turned out that I had a full femoral head break on my, so that means basically the top ball of your hip where it goes into the socket right below there had fractured. And because I'd been moved all around, it sort of got knocked out and around. That's, I think, why I felt like it would popped out. And I went into emergency surgery because that's a pretty serious break. It damages a lot of vasculature, and they did a hip pinning that night. And there started the next sort of part of my journey where I'd been doing better, but I remember being still really exhausted and still getting myself to do, like, my days they had to be the formula. Like, you had to go to the gym, you had to do your schoolwork, then you did this thing, and then you ate your healthy lunch, and then you did your schoolwork, and then you da-da-da-da-da, and you tick the boxes. And I can remember waking up in that hospital bed kind of being like, thank God somebody is making me stop. Like, and I've heard this from others now, having shared my story a lot and talked to others, and others who've said, yep, I actually was super relieved when that extreme thing happened, or when nobody took the choice out of my hand, when someone took the choice out of my hand. And so at that point, it was a whirlwind. I was still like going to go back to school in the fall, and with hips, they don't actually like cast you or anything. You start right into like walking around on crutches, and you slightly weight bear because it's supposed to like have compressive force that like starts to knit the bone. You just don't fully weight bear right away. So I was up on crutches really quickly, but still convalescing at home. And I had lots of physiotherapy basically over time, and I decided I was still going to go back to school in September as I had planned, but on crutches. And so I went back to school in September. At this point, though, I was in pain a lot. I was on a lot of painkillers, still taking my Paxil for anxiety, depression, and it was just overwhelming. I couldn't really go out and do anything. So for a month, I had been sort of just in bed and going to physio and doing that kind of stuff. As you can imagine, that made me almost more obsessive with things like food and with, I couldn't really exercise, but with like my formula of my day, because I felt so out of control. I just felt so out of control. I wanted anything to glom onto. And so when I went back to school, I sort of managed, hulking my way around like a little tripod. And it sort of is a blur. But then over the first sort of semester, I would go to the doctor to get it checked out every however many months. And one time I went and they took the x-ray and he was like, okay, it looks okay. And my mom was like, the pin looks bent. And he was like, you're right, it does look bent. And the physiotherapist had me weight bearing, which is fine. It wasn't their fault. That's the progression. But because my fracture had been very vertical, you could say, normally when you heal a bone, you want there to be compressive force. So that makes the bone, it stimulates it to heal. Okay. But what happened was as I was weight bearing, instead of pressing them together, it was almost like shearing. Like, like two things more like in parallel. So it wasn't healing properly, and the pin actually bent a little bit. And he said, okay, the thing we have to do now, and this is like the next stage option, is we do something called a femoral osteotomy, where we're going to remove a piece of your femur, and we graft it into the break, and it changes the angle of the fracture, and we have to move your leg around a bit and stuff, and then we bolt it all together. And where we took the piece of the femur, we have like bolts holding your femur together so that it grows back together. You fill in that gap. And then because the fracture, again, is now so much more horizontal, as you start to weight bear, it will start to stitch together. But it meant like another however long on crutches, right? Mm-hmm. So for my reading week that year, I went in, because I was still going to school, I went to have this surgery. And I will say the surgery worked more quickly because of those compressive forces. It healed faster. At this point, I was seeing a dietitian as well because my body had been under so much stress that I'd lost more weight. I would say like I was eating pretty okay, but I'd always had a fairly good metabolism. I had always probably, and for the past little while, had been probably eating not enough for my activity level and for what my body needed. Mm-hmm. I remember I used to get comments all the time, like, oh, you're so little, but you eat like that? Oh, wow. And that would go to my head, and I'd be like, maybe it's too much. That's more than normal people eat. Okay, so I guess I shouldn't eat that much. And so I think over that period of time, again, I lost even more weight and I got more obsessive, because what's interesting about when your body isn't well nourished, it's a catch-22, because the more you are malnourished, the less well your head is working, your brain is working basically, and also the more obsessive you get. And there's lots of studies to support this in terms of your franticness and so it's very self-perpetuating. So at this point, I had been on crutches for months and months and months. I wasn't seeing friends. I wasn't really talking to anyone. I felt like a bit of an outcast. I felt uncomfortable with how thin I was, actually, even though I was still obsessed with. I would be embarrassed at school. Oh, here comes my voice, because it's coming in little bits. And I would be, like, I'd have to walk into the class. I was often late, and then in I would come on my crutches, loudly pushing through the door. And I felt socially very awkward. And as you can imagine, all of this is like an integration of my physical and my mental wellness. However, nobody was, in my acute care, I'll call it, was talking to me about how I was doing, other than my leg. So I used to say, I'm like Emily the leg. I may as well just be a leg, right? Because the rest of me apparently doesn't matter, even though I'm depressed and in pain a lot and dealing with these other things, which in some ways my quality of life was more affected by. That wasn't really on the cards. I was still seeing a therapist and I was still on medication, but it wasn't a lot. And so finally I got to the point where we decided that we were going to look for some more intensive treatment for me psychologically. And my family doctor recommended that I go to a place called Homewood.
I know Homewood.
Do you know Homewood? Okay,
yeah.
So Homewood is a private/public health place in Guelph, and they have amazing programs for anxiety, depression, post-traumatic stress disorder, alcohol, drugs, and eating disorders and everything. And so because my body had been so depleted and I was obsessing over the food, I got into the eating disorder program, and my father's health coverage covered it, because it is freaking expensive to go to these things, these beds. Now they have about 3 OHIP beds at the time, I think, in the eating disorder program. I can't remember how much they had in the mood program. But I went, I finally got in after waiting about 3 months, at which point I was just so depressed and anxious and obsessive. And I think my parents were kind of at a loss of like what to do. We were just waiting. It was like being in limbo. It was like waiting on the doorstep, just going, okay, guys, let me in so that I can help myself here. And finally, when I got in, it was terrifying, but I started the program, which is based actually on how your weight progresses when you go in when you're underweight. Now, I was integrated in with people who had all types of eating disorders. They don't sort of separate people out. So lots of people, I remember I had a friend come visit me once and she was like, is that person in the eating disorder program? I was like, yeah, what do you mean? She's like, but she's not even. And I was like, oh, that is a misconception about eating disorders. They come in every shape, size, everything. People's bodies respond differently. There was people with bulimia, there's people with binge eating disorder, but they treat us all as if we're using food as a coping mechanism, right? We're all using these things to feel like we're in control, and in fact, many of the treatments are very similar for all the programs, right? And it's helping deal with those underlying issues. But until you restore your weight and until you are physically strong enough, you can't be mentally strong, right? So that was a primary goal, and I think it was a real recognition for me about how much of my psychological state was governed by these physiological aspects of myself, and that neglecting those things, it was impossible to try to work on, things with your therapist, or whether your mother was this or that, and whether, the psychoanalysis, if your body is depleted, or if you are physically in pain, or if all sorts of physical reasons, right? And so I started to learn a lot about that, but also they just sort of feed you. And the problem is, for me, is I didn't gain weight easily. And I ended up there in their therapy programs and with other people, watching people graduate through the program. And I wouldn't move up in stages because my body just wasn't doing it. It was just, I don't know if it was from too much physical stress. I didn't add in before, but I actually had been diagnosed with a thyroid issue too. Probably because my body had tried to slow itself down because of all the trauma. But then they gave me medication because I needed to be able to think properly. But that meant my metabolism went up even more and my weight had gone down even more. And so I had some counter things going on. So in this program, it was really rough. I was eating more than, and it's funny because I think I hear this also from a lot of people suffering from eating disorder. You have this image in your head that if you change one thing about your day, it's going to throw your whole body into whack. Then you go into a program like this, and they're literally, I had to eat, I was on 3 meals and 3 snacks and boosts 3 times a day and extras, as they call it. And sometimes my body wasn't even gaining weight because it's just been so much depletion. And also because our bodies don't respond. It's part of the reason I get frustrated in this day and age with this whole calories in, calories out, and as long as you do this and that. Everybody's body is so different, and we all have these different needs. And as much as there's some great lessons in some of the dietary advice out there, a lot of it is so generalized that people fall into these traps. And I thought, but I already eat fine. I should be this. I should be that. But yeah, I learned a lot about my body and what it needed. And I did gain weight, but finally they got to the point where I didn't reach my goal weight, but they said, we think you should leave because it's just too long. I was there almost 6 months by this point, and I had done all the groups 5 times over, and I'd sat through so many group sessions, and my thing was often that I would feel guilty because we'd be in these groups, and I would think to myself, why am I here? What happened to me that I need this kind of therapy? There'd be people in my program who had been through such trauma and such difficult times. And with eating disorders, there is a common correlation with sexual abuse. And I would hear these stories. And I mean, by the time I knew people, it was okay kind of to joke, but it would come around to me and I'd be like, in my childhood, I had ponies at my birthday. That's my thing. I don't know. My mom brought in ponies to my street. I had such a good childhood that maybe I just didn't want to grow up. Maybe this is a regressive thing. That's all. I'm drawing at straws here, guys. And then meanwhile, I was also, though, just starting to make the connection between this idea that all of the physical stuff I was going through was really affecting me psychologically. And that I had lost a lot of friends and that I didn't have some of these basic things that they were suggesting that we have set up. And I didn't really know how to cope because someone had always coped for me. Like when I was in trouble or when I needed something, I felt like it was there. And I think that is really something that I took away. The other thing I will say that is was somehow a ha-ha moment was how little integration of psychological and physical health there is in the health system, and that I needed these very disparate, separate types of treatment, one to deal with my head and one to deal with my body, even though I felt that it was so intertwined. Now, the mental health was much better at integrating, and it cost me a lot more to get those lessons in terms literally of financially. But yeah, so I learned a lot. I would say, though, I kind of took from it, I think I left, and this is true, I hear this from a lot of people who've had intensive inpatient treatment. You leave and you're kind of like, yeah, I get it, guys, but you know what? I got my own way of doing it. I'm going to take what you said, I'm going to get my own thing, and I'm going to put those together, and it's going to be awesome. I'm going to be just like perfect. And so you leave and you don't do that thing because you didn't really like to do that, and like who likes journaling anyways and all of that. And I think I very quickly started to, not do everything perfectly. So my weight was okay, but and I tried to go back and be friends with some people. I had some difficulty integrating back in. I had lost my sense of myself as I think even a woman or a female or just like a young person, because I had been just a patient and I had focused so much on getting better. I didn't know what like dating was and what that, so I didn't feel like I could integrate right in. I kind of just wanted to do crosswords, and I like talking to older people because older people also have broken hips and like, right? Like I kind of relished it in a little bit of an angry way. Like, I'm not a young person, fine. I'm just going to be like an old person and I'm going to stay home with my parents. And I just like watching movies and reading the newspaper or whatever. And that was okay. But I went back to school again and I was now feeling really out of place because like my TAs in class would be younger than I would be. And I'd be collaborating on projects with people who felt like they were just out of high school. And I was like, you haven't even been to the school of hard knocks. You know how you get when you've first been through something. I think you get a little bit of a chip on your shoulder of like, I've seen things that you... But really, you have no idea about anyone else's reality, and we all have But anyways, I think it was a little bit in that stage, and I think it was partly just anger. I had started seeing a therapist again, and so all this was kind of trucking along. I was doing okay. Again, I wouldn't say great. I was still in pain sometimes. And anyways, so came to sort of mid-semester, and it was family day, which is coming up now. And I was at the cottage with my parents, and we were driving home, and I had taken one car, and they'd taken another car. Luckily, the cat was in their car, because as I was driving, the weather was all of a sudden turned, and it was really bad. And a car, an SUV coming towards me, was speeding, and it lost control and 360'd basically into my Ford Focus and completely totaled me, and I ended up in a ditch in the car with the windows all broken. And I woke up, I think it was like a brief second, I was probably out. And because I'd seen movies and never been in a car accident and there was smoke, I was like, the car's going to explode. Oh my God, I have to get out. Meanwhile, it's the airbag just sort of steaming. The airbag had been a punch in the face, and it's probably what knocked me out for a second. I was bleeding, and my window was broken, so I literally crawled out the window, and some man who had pulled up behind me was like, oh my God, just like stay here. And I'm like, it's okay, I'm okay, I just need some snow. And I'm putting snow on my face to like ice the wound, because I'm all medical, and I'm like, just take down the inflammation. And then I was like, so, there's a car behind me with my parents who are going to see this, and they're going to see this car, and they're going to freak out. We need to tell them that I'm okay. And so I got the guy to call my parents, and he said, I'm with your daughter, there's been an accident. And I'm like, don't say that, say she's okay. And anyways, so he told them like she's here, and then the fire trucks all came, and they took me in the emerge and took me to the ER, and I had glass all stuck in my face and in my hands. And I was just like, I think at this point I was like, sure, why not? You know what? Let's just do it up, because I hadn't tried out car accidents yet. I thought that would be. And so I was lying in the bed, and I just remember the guy beside me being like, is she okay? Is she okay? Because he was the guy who hit me. And his wife just going, shh, be quiet, don't say anything out loud, because, like, they might see. Anyway, so after this, about 2 weeks later, I was back at school, and I started to have panic attacks, and I was one day walking down the street, and I was just like, you know, you have this, like, I'm having a heart attack, oh my goodness, what's going on? And because I had enough experience, I was like, oh, this is a panic attack. I've never had a full panic attack before, but it's probably to do with I was having nightmares, and so I had tried to go back to school, but we realized pretty quickly that, like, this car accident had just set me back in a bit of a spiral. This time, instead of wanting to not eat, like, for control reasons or to control my eating, I just, like, I couldn't take care of myself. I was just depressed immediately almost and exhausted, and I couldn't go to classes. I couldn't think. And we were like, oh my God, here we go again. What are we going to do? My body weight sort of started dropping again. And I think this time we were like, you know what? We know something that works. We know a great program. Like, let's go into it this time being like, we know what to do. Let's go back to Homewood. It's totally this car accident. And so we set in motion kind of the lawsuit to say that it was not my fault. And there had already been a charge of careless driving. And so we were like, look, I have to go now, but I think we're going to try to claim this. My dad's insurance didn't cover it anymore. So we took out a loan, a massive loan, got me back on the list, and I got in after a few months. In the meantime, and I think I'm getting this timeline right, I think I went in, before we made this decision, I do what I think probably happens far too much in the health system is, and it was on recommendation of my mother's psychiatrist. She said, take her in through Emerge because she probably should look at a change of her meds. Paxil's not really used that much anymore. It might not be suiting her. She might need something more. If you go in through Emerge and they put her in hospital, they can monitor her change really a lot faster, and you can do a lot more in a shorter amount of time. So get her in. So I went to the emergency room, and I got triaged in, and I just remember a doctor being like, so tell me, what are you here for? And I kind of was like, look, this is what happened. I've done this. I've been to this program. I have this therapist. You know, I do this program. And he was kind of like, don't you kind of think too many chefs spoil a soup? And I was like, I'm getting the feeling you've had very little training in mental health, because that's maybe the worst thing. I already felt kind of ridiculous being there. Like, what am I doing here? And I just burst into tears. And he's like, okay, look, we're going to get you talk to someone. I don't really know what we can do for you, given there's nothing acute sort of going on here. And then they triaged me to some psychiatric professionals and put me in a padded room, literally. And there was two very different minded people who talked to me, and they talked to me like I was a real person. And they said, it makes total sense that you came here, and we're going to help, and we're going to get you. And they did, because they had to move me to the psychiatric unit at a different hospital. They had to actually put me in an ambulance, like strapped into the ambulance. So you're like, this is weird. I felt like I was in a straitjacket, and they got me in, and then the nurse assessed me, and then I ended up in the psych ward in the hospital. And this was I think just before, we decided that I should go back to Homewood. So I spent I think the period was like 2 weeks there while they monitored my, and I would have sometimes where I could go on a pass with my family. And I mean, I was there voluntarily, so I could technically leave every time, but they did some woodworking, as you do in the psych ward. And, you know, because they monitor people who are very danger to themselves or others through the glass, you watch the people on the other side of the glass who are literally yelling and screaming. And yeah,
I'm the person on the other side. You are the person on the other side.
I thought I recognized you.
Did you? I think I've seen you before.
Right. I was the one with the crayons.
Were you
sitting in the? Yeah.
I had crayons too.
Did you?
Yeah,
okay, yeah.
We couldn't get pens or pencils.
No sharps. No sharps. They say, yeah. So I would be amongst, and they really had no training in dealing with. It felt like they didn't have much training at all. Actually, it was interesting because I would try to talk to them about when I would see my nurse. And I just remember sitting and trying to eat breakfast, and my huge male nurse, he was like 6'7", and he sat down next to me. He's like, oh, good job, honey. You can eat all that for breakfast? And I'm like, this is just not what I need right now. I already feel like I have to eat so much more and I know I'm skinny. I know, and you're surprised that I eat this much. But he had no, and I said to him, you know, I don't think you should say that to someone with an eating disorder. And he was like, I don't know. And like, da-da-da. And he sort of talked to me like tell me more. And it just dawned on me that, like, this is unbelievable. This is not, like, a good place for me to be, but I did need to see the psychiatrist to get the medication. They did switch me over to a fixer, and they ramped it up real quick so they could monitor me. And, I mean, I guess right away it seemed to be doing okay. It's, again, hard to tease out what was what. I made a lovely wooden duck for my mother, which was one positive outcome of this situation. And like I said, I got on the list, I think at this time, for Homewood. And so when I was released, I was pretty darn depressed. But I was depressed in a way where I think I was just like kind of that why not thing, where I was apathetic to my own cause. It wasn't even like any more like, let's get better. I think I was just like, I am here. And all I would do was wait for the end of the day, it felt like. And so, anyways, and finally, I did get it back into Homewood. And I think when I went to Homewood this time, I, again, took a little bit of a different perspective. And I was like, okay, this time, whatever you tell me to do, like, I'm going to do it. Because, like, that didn't work last time. And I obviously wasn't really listening in a way that I should have. And also, give me 3 snacks right away. Don't ramp it up. Like, honey, I need this. And it was a different experience. Equally amazing, and I find both of my times there were an absolute gift to me in terms of learning about humans and about everybody has something and a story, and that the meaning of life is other people. Because really, learning about other people and hearing them and sharing with them, it was what took me through the day. And having people that love you is not something to take for granted, or that you love, because not everybody there had that either. And also, when you're at feeling your worst, you can laugh your hardest, because there were like a bunch of us at one point, we're not supposed to, but we, on one of our passes where they let you out for a little bit, we actually took our hospital gowns and went to the grocery store, in our, like, me and these other girls in the eating disorder program, put on our hospital gowns with our bracelets and took pictures of ourselves holding like bags of chips and being like, ooh, look what, and going out for ice cream and doing, but like playing up the mental health like escapee thing, just because we were. And again, it's a little bit of a in your face like screw society thing, but we peed ourselves laughing. I'm sure I peed myself for other reasons too, given my physical issues at the time. But anyways, I think it's an amazing experience that I would never wish upon my worst enemy, but I would also never give back. And the people that I met, some of them I still connect with. You have to be careful with that, I think. You have to be careful because you can become very codependent with people that you recover with. They definitely aren't looking into you having relationships there of any sort of romantic nature. Although that happened a little bit to me too, in terms of, I don't think there's a joke about, as you recover and when your weight gets restored, all of a sudden your sexuality comes back too, and you're kind of like, whoa, hello, that's, I didn't remember that part of me, but yes, there is that part, and you kind of go into a little bit of like puberty all over again or something. Anyways, so I think there was a bit of that rediscovery, and when I left this time, I was set up with a different psychiatrist in Toronto this time. I was feeling a little bit more realistic about my expectations and what I was going to accomplish. I think when I left the first time, you feel so much better than before, and you're so thinking you're in control that you're like, now I will be president of Canada. Like, you're just sort of...
They already have a prime minister. They need a president.
Yeah, you think that you could sort of do anything, or you all of a sudden have all these new ambitions. This time I left, and I think I'm like, how about just tomorrow? And we do that. So I came to Toronto and I got an apartment. We decided it was definitely healthier for me to not live at home anymore. We had developed some serious... My family is so wonderfully close, and they've been amazing through this, but because we'd been through it at such an intimate level, the codependency, like, one of us couldn't have a feeling without the other one immediately having that feeling too. Or, and as my mom always says to me, you can only be as happy as your saddest child, and I'm her only one, so I think there was some of that. And so I think we knew it was healthier. I was an adult. I think at this point I was 25 or something, or 6. And so I moved to Toronto. I had been sort of doing private tutoring throughout. I had decided I would finish. All I had was like 2 courses left of my career. I always say, I went to school for like 10 years. I should be a doctor. I am not. But anyways, I did see a lot of doctory stuff. And so at this point, my pain level was, was a lot better. I had to walk pretty weird because my leg, when they had done my second surgery, had been almost I'll call it screwed on differently. So it would sort of point out to the right. And so I had some issues with that. And I came back to Toronto and I started seeing this psychiatrist, and then I ended up tutoring. And then after a few months, I started to have some pain again. And I was like, oh, I recognize this pain in my groin, and that is not serious. So I went to Emerge, and they did an x-ray, and they're like, there's nothing really there, but let's check this out with a CT because you have a history. And so they did the CT scan, and during my waiting for the results, I remember thinking, like, okay, I think it's just inflammation because blah, blah, blah. And I went to the doctor thinking, it's all good, I just need a steroid shot. And the doctor said, you know what, over this time, your hip has died. The vasculature had been so damaged during those other breaks and surgery and whatever that your hip bone is basically disintegrated. We don't know how badly yet, if you can have what's called an allograft or if you need a total hip replacement, but it's going to be one of those. And I was like, okay, again, I think I was like, sure, why not? Let's do this. And
so you're 25 at this time.
Yeah, 26 maybe at this point. So, and I'll try to speed up the end part, but basically I ended up first having to have all the metal removed from my hip because it was all in there, but they needed to do an MRI to see how bad the hip was. So you have to get all the metal removed because, honey, you don't want to go into an MRI with all that in there. It just also, you can't see anything. So I first had a surgery to have all the metal removed. Then I had to be on crutches again to basically let that heal sufficiently. And then they gave me an MRI. And MRIs run 24 hours a day. So I had an MRI at 4 in the morning. Slept for like 5 seconds in the Mount Sinai chair waiting because I had a therapy appointment at 9 a.m. that day, just down near there. And at this point, I was driving back and forth at this point I was in Toronto. So anyways, once they did the MRI, they said, yeah, it's really bad. Like, it's completely disintegrated. You have to have a replacement. At which point I was kind of relieved because the other option had been a lot longer, and I would have actually had to wait for a cadaver hip to be grafted onto my hip and all this stuff. Mount Sinai is one of the few places that does this. So then I was on an emergency list for a hip replacement. So to me that means, like, I'm in next week. No, that's not what that means, apparently. I still waited a few months and finally got in. So I was on crutches again, just waiting. Finally got in and had the hip replacement done. And as much as, and I'll sort of gloss over some stuff here, but as much as the recovery was really rough and I had a really tough surgery, you wouldn't believe, but all through this, I didn't actually have low bone density. That first break, they still don't know entirely why, because I had my bone density tested and it was actually higher than average. And when they went to put the hip replacement in, actually, they had to call someone else in to drill the part that goes into your bone in because my bone was so tough. So we still don't exactly know. It wasn't osteoporosis. But anyways, so I'd had a very serious surgery, lost a lot of blood, needed blood transfusions, all this. So my recovery was longish, but at the same time, when I did recover, I wasn't in pain anymore. I hadn't realized that basically all the time I was walking around for probably years, my hip had been microfracturing and little breaks and then healing and then little break, and then because the bone had been like mush. He took a picture of my bone. I asked him to because I like all that gory stuff, and he showed me and he said he just tapped my hip and it literally just fell apart. Oh, no. And yeah, so what amazed me was with the relief of pain, I'm not going to in any way say that psychologically I was fine, but the relief of pain led to so much more progression with my recovery and my mental health, and I hadn't realized how much that low-level pain had been affecting me. And like, this is going to sound hilarious, and then I basically was like, okay, and this court case had gone on. It had been going on throughout. There's a whole other story about, we can do another show about, getting my court stuff released from my psychiatrist and then wanting all his records and me saying no and what that meant for my case, and it's a whole other thing. And then me leaving that psychiatrist because of that might be a whole other episode. But yeah, after that, I was doing well. I finished school. I got my degree. I started, I had basically enough money from the lawsuit to pay back my parents for paying for this treatment and to have a year where I could just tutor and do some volunteering and figure out what the frick, am I allowed to swear in this?
You can swear.
And the fuck I'm doing with my life. And that's when I got involved with something called Patients Association of Canada, and I found out about this world, this concept of what you've learned experience-wise being of interest to the medical world, and that it wasn't just about advocating as a patient for like, we need more of this. It was like, no, actually insight from people lived experience is going to be essential to us having a healthcare system that is responsive and that works with people with chronic diseases and mental health and these things which don't just go away when you leave the hospital, which require self-management, which require involvement of your family, which require... There's no way that just a recipe or a clinical trial can figure out what we need for that, and that working with people to understand what people need is going to be essential for the future of healthcare. And I really credit Shalom Gluberman, who I worked with through the Patients Association of Canada, later Patients Canada, for really introducing this logic to me. And I started to get involved with conferences, and I volunteered. I offered myself up, I would say, to whoever would have a coffee with me or take me to volunteer in places that I thought were doing amazing stuff. So one place I ended up volunteering was the acute care for the elderly ward at Mount Sinai, which is run by someone named Dr. Samir Sinha, who now runs the sort of the older adults strategy in Ontario. And he had this amazing program which was looking at what's called the iatrogenic effects of hospitalization is on seniors, that seniors come in with an acute problem and they end up leaving hospital sicker than when they went in, because although their hip is better, they didn't move, they didn't eat properly, they didn't really talk to anybody, and they have declined significantly in their ability to self-care, and then they end up needing long-term care. So it's completely counterintuitive. And I really empathized with this concept. I thought, well, that's how I felt going into the medical system, was, sure, you fixed my hip, but good Lord, did you also kind of screw me up in other ways, like because the lack of support and the lack of other things. So I did that, and that's how I kind of got into the work that I'm in this quote-unquote patient engagement, which is now a bit of an industry, again, a different show. Mm-hmm. And then, in the last 5 seconds, I'll say, and then I met my husband and got married and got a house and had a kid. And all that also just happened. But even though I resigned myself to being, excuse the phrase because I know it's not appropriate, but crazy cat lady, I was like, I'm cool being a crazy cat lady. I love cats. And like that means that I can just, do this and that, and I was cool with that. But in the end, I'm like nuclear family, normal person, and it's kind of freaky. Luckily, my son is sufficiently odd that I'm like, okay, you are a spawn of me then. So I don't mean to minimize this and make it all a joke, but I have to laugh throughout because it's been quite an adventure, and I'm sorry that was so long-winded. It's sometimes hard to get it all, and I'm sure I could have gone more into detail in places and less in others, but that's as far as I can remember, that's what happened.
That's the story.
That's the story. And I'm happy to honestly answer like all sorts of questions. I'm pretty, as you may have noticed, I'm pretty open. I'm not too, I don't have many boundaries at all. In fact, people don't even know I'm just sitting here completely naked.
True story.
Yeah, right.
So you were saying that you found after the hip replacement, your mental health improved. What were you doing around that time other than therapy? Were you participating in any of the art therapy that your mother does? Or?
I didn't ever really do that, partially because my mother was enough of my therapist throughout this anyways, and crossing into her world too much is, although we should do a show about art therapy because the way she does art therapy is pretty amazing. But I had a psychiatrist who I think he was a good psychiatrist up until he really wasn't. And I had some issues in terms of the way the treatment was going, but he definitely, I was progressing in terms of my ability to socialize, to my making connections. I was working with, at the time I wasn't working with a dietitian, but I think I'd almost been over dietitians. I think I definitely knew how to do things. It was about implementing them. And like I said, as much as it sounds sort of weird to say, like I genuinely don't gain weight very easily, and so I still was struggling a bit in that regard in terms of getting myself to eat the amount I needed, I think, but I was fine. Like I had energy, and I had, it's more like, if your grandma sees you, she's certainly going to be like, you probably need to eat some more pasta and like have that kind of thing. But I wasn't it definitely wasn't overwhelming my life. And I'd say in terms of my sort of day-to-day, I always, and I think I said this to you before, but my measure of when things are kind of okay is if I can look at the last 3 weeks of my life, and if someone said, okay, this is the way you just lived the last 3 weeks of your life, that's going to be like Groundhog Day for the rest of your life. Is that like a manageable thing? Are you cool? Are you okay with that? Or is it like, oh my God, if that is my life, I can't do it. Like if someone told you that you're going to live the last month over and over again for the next, and I'm not saying like you got to have loved it, but if I can be like, yeah, I could cope with that, then it's okay. If I cannot say that, if I'm like, oh my God, if someone told me I would just need to disappear, like I can't do that, then something needs to be looked at here. That's the level I'm aiming for. I think we have a totally misunderstanding of what sort of happiness or being okay is. It's like as if it's supposed to be elation every day, or like something magical was supposed to happen today and it didn't, so my day was crappy. Like, no. Like just getting through and having a little, like almost, if you didn't notice the day, then okay, great. It must not have been that bad.
That's a good one.
And if you even had enjoyment in it, then better, great. And generally what I find is as long as there's other people in my day, it's usually okay. Like
it's a good day.
It's usually okay. And now I have a kid and a husband, and so there's always other people in my day. But also, I learned the importance of developing communities and of not waiting. I think the other big one was not waiting until you're better to do the things that would help you get better. Sounds so weird, but a lot of the time you're like, well, once I feel better, then I'll feel more comfortable going out, and I'll feel like I can wear that shirt, or I'll feel like I can try out for that job or do that thing. Once I feel better or look better, I'll do that. And then you don't do it, and then you feel more horrible about it. And now that's not to minimize the fact that sometimes you are paralyzed by being able to do stuff. But I did realize that so much of my life had been waiting to recover, or waiting to get into that treatment program, or waiting for that treatment program to end, or waiting for this thing to be done, that I was like, you know what, I think I better just deal with the cards I have today, whether that means that I'm on crutches today and I have therapy today. That is just as much of my life as it'll be once I'm off the crutches and I'm done the therapy program. I can't expect that day will be great because everything, all the stars will align and it'll be great. So finding your capacity for happiness is, again, it's sort of a misleading word, but finding your capacity for being in many different realities is super important. It's also important so that you're not afraid of certain realities being true or happening. I think the more different things I've been through and the more I've been taken off the path I thought I would go on, the more I've realized that, like, oh, but you know what, I got taken off that path, but then this other thing happened and it was actually okay. That's one of the best lessons in life, because the fear of never feeling better or things not going the way you thought, I think it's why probably a lot of younger people tend to be but like there's issues with suicide. If you've never had experience coming through or something different happening or things changing, it's really hard to imagine it. It really feels like this is just it. So yeah, I could go on lessons learned I could write
I'm enjoying
one of those flip calendars of like 365 days a year. But please ask more questions instead.
So I have a question. You bought to light, which I never thought. I've never broken a bone. I broke my pinky finger vacuuming once.
Oh, ouch.
Yeah, I did.
I don't minimize
my pinky finger vacuuming, but I've never broken a bone. I've never every experience I've ever had has been a mental health issue within the hospital. But you brought to light the physical and the mental, and how those two work in conjunction with each other. So I'm wondering, what have you seen since? What changes? Because I know you're a part of a lot of organizations. You do a lot of stuff in your spare time related to both physical and mental health. Are you seeing any changes in our communities that might solve this problem of the mental and the physical not necessarily going hand in hand?
Well, I wouldn't say solve. I don't expect ever things to be solved. I think it's always going to be a sort of ongoing process because humans will change and needs will change and things. But I will say tremendous progress since even I started in this, and as much as I feel old, I think, like, in the scheme of things, I haven't been in the health system that long, and there has been massive change in terms of the integration of mental and physical health. And I think a lot of that stems also from the concept of sort of social determinants of health being much more recognized, that health is not, you know, just your blood levels and your measuring your sugars and doing that thing. Like, health is actually an integration of your social situation and your relationships, and all of these things have such a huge effect on your health and your health on them that we can't sort of pull these things apart anymore. What we're realizing is that treating things like your income level or your social situations, these things can have massive effects on your health, and therefore we need to integrate them into the healthcare system. And I would say places like St. Mike's and other places in Canada and internationally are starting to integrate these things and start to have like a poverty clinic in their healthcare, and start to do things like address people's mental health when they're in, for instance, the acute care for the elderly ward I was just telling you about. Now, that was when it started. I mean, I've lost track of time, but it must have been at least 10 years ago. So that was a while ago, and now things like that are much more normal in the health system. I think also involving community care a lot more, so that we're having to think beyond just acute care interventions. And once you get beyond acute care, it's almost impossible to ignore things that relate to mental health. I think also from the mental health side of things, there is a much more of a and actually both sides push to integrate in with other healthcare systems, because what we see is, you know, you can't just leave the emergency room or leave these places and just go back to, a lot of the times the next place you need to go might be somewhere like CAMH, or you might need trauma intervention, or, you know, we can see and scientifically we can see how intertwined they are. So I definitely think there's a movement, and I think there's a lot of great people actually trying harder to integrate the two. I still think that conceptually we have a weird understanding of mental health, because like we don't say like they have a physical health issue when we talk about people. Like, we very much more have nuance to our physical health, and I think there is a lot more nuance to mental health and what extremes there are in mental health issues, and what it means to really suffer from a mental health issue just to be versus having a bit of a tough time right now. And so there's mental health, but it's almost like we've started to consider mental health just the way we consider wellness generally. And then what we need to do is start to really understand how we can better treat like certain types of mental health, and address things like, you know, for people with bipolar, they need this. We need a better understanding of those. Anxiety is such a broad term still. Like, it's very much less nuanced and less specific often than some of the physical health stuff, which makes it tricky, right, in terms of a health system to approach it. So there's lots of tricky stuff out there. I don't claim to like have answers for a lot of it.
Okay.
I'm just sitting back in awe. There's a lot of things that you cover that I'm like, oh, I never thought of it that way. Like the whole Groundhog Day thing, that was... Yeah. I was like, yeah, if I need to be able to think the last 3 weeks, if I can relive this over and over, then it's a good time. Yeah. Otherwise,
like, and also, like, sometimes I think the other part we do is we jump, especially if we've had mental health issues in the past, we tend to jump when we're feeling kind of crappy or bad to like, oh my goodness, call up the therapist, get me on a new medication, and we ignore a lot of the really basic stuff that we maybe haven't been doing that week. Like, literally, are you just like not eating properly? Have you been outside? Have you done, regardless of whether you don't suffer from mental health issues or if you have things like schizophrenia, bipolar, like starting back at the basics. No, I shouldn't have said that because I don't know much about like.
No, I'm bipolar. Feel free.
No, but what I mean is, I think we jump. We for ourselves, we forget that just like other humans, we have needs that first, in terms of our fulfillment, are going to set the foundation for being able to cope with the other stuff. So before I start to question, again, like whether I need psychoanalysis, I try to stop and go, you know what? Of the past 3 days, been really rushed around. Did you not eat properly? Are you exhausted? Mm-hmm. Are you talking to any friends? Let's start there. If in a week of like trying a little better with that stuff, you still feel exactly the same, like, okay, again, like maybe it's an issue. But I really try to simplify it that way and have lower expectations and I this sense, but like given my issues and my own physical like physiology, like I often need to eat, and I often will need to be like, no, today is more of an eating day because I need to recoup from whatever happened, and I can tell I'm depleted and my brain isn't thinking properly. And often once I've had a day of like a better sleep and better eating and better, it's amazing how you can go. It's a bit frightening, I find, actually. I can go from a day where I feel like I got to go back to home, like I need the anxiety program, I need all of this stuff, I don't know if I can cope, to a day later being like, I'm fine, honey. Again, like President of Canada, here I come. Like I'm taking over, like that. And I have to catch myself. You know, when you're thinking like that, you got to be like, okay.
Like grandiosity.
That's called like, why don't you choose one thing to do? Maybe it's more of a grocery store trip today. Mm-hmm. It's more of a manageable goal. But it's amazing how much your psychology can change with fulfilling some of your basic things that we neglect and we don't relate to our mental health, but are really intertwined.
Now, I don't know if you've covered this, but I want to ask you, this is the last question.
Yeah, no problem.
What is the most challenging, or I don't want to say greatest, but like the biggest lesson you learned throughout your this whole mixed up, interesting history that you have like this?
Yeah. I'm going to answer it like just the most horrible answer. It's to not try to find like a lesson or like a meaning or a thing. Because the more I do that, the more I condemn myself to feel like I've answered the question or I've found my goal or I've found my place. And I feel a lot more peace in it not being like it happened to me for a reason, or I learned this thing and now I've come to the point where I know. It allows me to still be learning and to not know. And because so many lessons I've learned, I've had to eat my words about and been like, I totally thought I knew that. And then this all happened and now that doesn't apply. So I don't mean to like avoid the question. I just think the less... And again, a whole other episode, but it's why I don't like things like Oprah and stuff usually, because I find it sets us up for feeling like if you read that book or if you find that thing, you will know what to do and will give you a plan, when the reality is it is an ongoing understanding and figuring out. Like literally, I will never be at a point where it's like, oh, I can't do that today. That's not working. I want to do the angel voice. Yeah, thank you. And like the stars align and everything is, I understand. And it's much more exciting this way. And I just want to be humble in it. I mean, as much as I can, is to just feel like, oh, you know what? It's just going to keep coming at me. And I'm just going to try to keep staying as grounded as I can.
Stay strong.
Yeah. And again, and make sure that you keep talking to people and meeting people, because people are just the best.
People are the best sometimes.
I know, right? Some people.
Some people.
Yeah, there it is.
Emily, that was, whew. I mean, what you have been through, I couldn't even imagine it. And you're sitting here, you're absolutely lovely. And, sharing your story is just, it was amazing. Thank you so very much.
Well, thank you for indulging me. It's a good long one, so I appreciate your listening. And good times, as they say.
Well, if you guys want to reach out to Emily or JR or myself, just give us a comment or a like, or you want to, get in contact with her and see what else she does within the community that you might want to be involved in yourself.
Yeah, I'd love to engage more people.
JR, please tell them how they can reach us.
Yeah, definitely. You can reach us at Dysh, DYSH, at daintydysh.com. That's DAINTYDYSH.com. If you're listening to us on Apple Podcasts,
give us a 5, you deserve 5.
We truly appreciate you. Thank you so much. Please subscribe. If you're listening to us on YouTube, SoundCloud, please feel free to subscribe. Leave a comment. We truly appreciate you. Thank you so much for listening. That's it for me. This was a listening day for me.
This was definitely a listening day for you. Active listening.
I feel like people find that when I'm around. They're like, apparently this was a listening day for me. I'm like, oh, weird. It was another talking day for me.
Nothing, but I'm gonna be thinking about this because I get to go back now and listen to this
Yeah,
again,
right.
and then like kind of like clean it up, edit it, and then put it out. So I'm listening to this like 2-3 times. It's gonna be a lot. It's gonna be good.
You just
good.
had me.
I'll be
I knew the story, but
Yeah.
you had me on tenterhooks. I'm like, oh my gosh, I know what's gonna happen next, but like I can't wait till she says it.
It's all about
Like-
starting with a dark and stormy night. That's the key.
We need to start all our podcasts with a
right.
dark and stormy
There you
night.
go.
But anyways, again, Emily, thank you so much for being on the show. I hope you will be a returning guest.
I would love to.
I would love to have you back on, even with your laryngitis voice,
Yeah,
that sexy
right.
transvestite voice that I like so much. That
Hopefully
smooth
it'll
jazz.
be gone. Maybe, who knows what I'll come up with next.
Yeah, who knows? Who knows? It could be bronchitis. Who knows?
Donald Duck. Yeah, there you go. I'll make sure I practice. Okay.
Well, with that said, that has been the dish of the day. I hope you guys have yourselves a very, very, very happy hump day.